Well, COVID cases continue to rise all around us, and a new vaccine is now available.
The federal government is once again offering free at-home COVID tests. You can get them at covidtests.gov.
Medical experts say now is the time to get the updated vaccine before you gather with friends and family for the holidays. University Health's Dr. Pothof is back with us. Welcome back.
Hi, Dr. Pothof.
Is this a here we go again?
No, I don't think so. Not nearly to the extent that we had it during, the middle of the pandemic. It's true. Cases are going up. We're seeing a little bit more of that. We're seeing hospitalizations go up a little bit in the state. But context is important, and comparative to surges that we had during the pandemic, we're not even close to that yet. So it's not to say ignore it. I think it's a good idea to get that vaccine that just came out. That reduces your likelihood of getting severe disease by a lot. But I think if we do that, that for the most part should do a good job of making sure we don't have too much of a surge of COVID-19 this fall.
Anecdotally, it seems like everybody is getting sick again now. And I don't know if it's the change of seasons or if it's that there's more COVID around. But at this point, should you treat it any differently than a common cold? Do we still have to quarantine and go through the whole protocol?
Yeah, I think so. As far as make sure you isolate, stay home from work. And the reason being is unlike the common cold or unlike influenza, there are some people who get really sick and still can die from COVID-19. So it's not like it was before, but it's still something where if I'm thinking, I have COVID, am I going to go to work? I'm like, probably not, because I don't know if I'm that guy then that makes someone so sick that that they pass away or end up in the hospital. So
and that's a reason to get the vaccine, so that you don't infect somebody else, right?
Yeah, I mean, it reduces a little bit your risk, especially shortly after you get it, of getting the virus, transmitting it to other folks. But the real benefit there is so you're not that person that gets COVID and then surprise you find yourself really sick, going to the hospital. Now you're on a ventilator. Once you start that journey, there's no do-over. So you got to be proactive about it. Get the vaccine so you don't get real sick later.
Are you running into some vaccine fatigue?
I think there's always a little bit of vaccine fatigue out there, but I think the thing that's nice about where we've landed with COVID is it's just becoming another one of those vaccines that you get in the fall. And we did that before the pandemic. There were vaccines that you would get sometime in September, October, protect yourself for the respiratory season. And now there's a couple extra ones, but it's not like people are having to get this every 6 months or whatever it was before, when it seemed like every couple months there was a recommendation to get a vaccine.
And now you recommend getting the flu shot at the same time as the COVID booster.
I think so. I mean, I'm sure everyone's as busy as I am. I don't want to have to go to CVS or Walgreens or to my doctor's office twice. So plan to get those on the same day. That's totally safe. Your immune reaction is totally fine. And then, yeah, you got, 2 sore arms instead of 1, but at least you're only going to the doctor's office once.
Use both arms, not all in one?
I mean, I would use both arms, but if you want to
I think so, too. Yeah. And there's the RSV vaccine out there as well.
There is. The RSV vaccine for those over the age of 60. Certainly talk to your doctor about that, but if you're in a higher risk group, there probably is a recommendation to get that. And then there's also a vaccine available for pregnant women that confers immunity to their unborn child for the first 0 to 6 months of life, reduces hospitalization by RSV by 91%. If you're pregnant right now and you're going to deliver during this respiratory season, talk to your obstetrician. That might be a good option to reduce the chance that your infant gets admitted with RSV.
And if you've been stockpiling COVID tests from the last outbreak, should you...
I got a drawers full of them.
Should you sign up and get new ones, or is it okay to use the old ones?
I would check your expiration date. So, and it's not enough to just check the package. Most of those will show expired. There is a website that you can go to that will give you your new expiration date. And if you have plenty of tests, you don't need to get these new tests. At the same time, I went online. It takes about 3 minutes to sign up and have COVID tests delivered to your house the week of October 2nd.
You can use the same website to order them. There's also a link
to check it.
To check the expired, the updated expired.
Because even the tests they send you now, the ones you'd get in the first week of October, will likely say they're expired on the box, but they're not. The expiration date's been extended.
Covidtests.gov is the site.
That's why they're free.
Maybe that's it.
So there's no reason not to get it. If you're traveling later, could you want to hold off a little bit if you're going to be going overseas or something?
I would say if this was a couple months earlier and you're trying to time respiratory season, there might be some logic to that. But right now, if you get vaccinated now, you're going to build that immunity. You're going to be really close to kind of the middle of our respiratory season. I wouldn't wait too much longer.
Yeah, all right. Just getting an appointment is tough right now.
Yeah, true.
Especially in Dane County. We all like to get vaccinated in Dane County. Doctor, thank you.
You bet.
Thanks,
Good
Dr.
to see you
Pothof.
guys.
Good to see you.